I'm looking at REM sleep behaviour disorder, or isolated REM sleep behaviour disorder, which we commonly call iRBD. And it's a sleep disorder where people actually act out their dreams. I've been a sleep scientist at the Launceston General Hospital for 10 years, and I've studied a master's in sleep medicine, which gave me a really big interest in sleep over the lifespan and how it does impact people as we get older. And this project is in collaboration with the Wicking Centre, which do a lot of research into dementia. Usually when we're in REM sleep or dreaming sleep, we don't move, our body is completely relaxed, but in this disorder something changes in the brain and causes people to actually act out what they're dreaming. And it can be quite violent sometimes. It often involves a lot of kicking and punching because people do tend to have more violent dreams. So it's usually the person's bed partner that notices that they may have something going on. My project is wanting to look at the prevalence of iRBD in Tasmania and Australia, because we've never done it in Australia before. So we're wanting to find out how many people do actually have this disorder. We do think it's quite rare, but it is quite important because there has been a lot of previous research in the world that has found that it looks to be quite an early sign of neurodegeneration. So it appears that people who have iRBD have quite a high risk of developing Parkinson's disease or dementia with Lewy bodies. So we've actually recruited nearly 3,000 patients into our study, and all of them originally completed a battery of online questionnaires. So there was a screening questionnaire for iRBD, as well as some other questionnaires about snoring and pain and COVID and a whole range of different symptoms. And so from that, we're inviting people who may have iRBD to come and do some further testing with us. So they've been invited to do some smell tests, which involve scratch and sniff cards, as well as some activity monitoring, which involves wearing an actigraphy watch for a couple of weeks to see whether there's any changes in their 24-hour activity patterns. And then we're also going to invite some to have a home sleep study. So they'll get to have a sleep study in the comfort of their own home to further investigate whether they do actually have isolated REM sleep behaviour disorder. I think because we need quite a large group of participants involved, it's been difficult to look at this, on a large scale. And also, in order to diagnose iRBD, people do need to have a sleep study because it needs a definitive analysis of their muscles while they're sleeping. And in Tasmania, even Australia, it's hard to get into sleep clinics to have those studies because they are very booked up and it can take months on end. So we've developed a system that's exactly the same as what people use in a sleep lab, but we've made it transportable so that we can take it into people's homes, and it just makes it a lot more easily accessible and able to do on a wider scale that we haven't been able to do before. I think it's quite an important study, especially in Tasmania. Because Tasmania does have an older population, we need to do research into the diseases that older people are developing in the hopes of, improving their health and their lifespan to reduce the burden of disease over time, because we know that rates of dementia are increasing, and we need to find out what is causing that and what can be done in terms of lifestyle factors to, I suppose, modify that risk and reduce the development of dementia and other diseases over time. My dad was recently diagnosed with early onset Alzheimer's disease. So I've always had an interest in sleep and neurodegenerative diseases, but when we found out that he had this disease, I wanted to, I suppose, do more to find out how we can help him and other people, cope with the disease and, just look at things that could improve, life and prevent other people from developing them in the future.